This is PT Pro Talk, the podcast for physical therapists who want to improve their clinical skills and be more successful. I'm Mariana Parks, physical therapist and your host, and today I bring you my conversation with Dr. Peter Brukner, where we discuss the role of diet in knee osteoarthritis and other health conditions. Dr. Brukner will cover his journey as a specialist in sports and exercise medicine, his experience writing the book Clinical Sports Medicine, how he developed an interest in the role of diet in inflammation, diabetes, neurological and psychological diseases, concussions, and more, his research on the impact of an anti-inflammatory diet on knee osteoarthritis, the importance of a low-carb keto diet and lifestyle factors in managing musculoskeletal diseases, and much more. Dr. Brukner is a leading sports and exercise physician, co-founder of the Olympic Park Sports Medicine Center, and professor at LaTrobe University. He has been a team physician for top sports teams, including the Socceroos and Liverpool Football Club, and co-authored the book Clinical Sports Medicine in 1993. Brukner also co-founded the public health campaigns Sugar by Half and Defeat Diabetes, and has authored two books, the best-selling A Fat Lot of Good and The Diabetes Plan. In recognition of his contributions, he received a Doctor of Science honoris causa from LaTrobe University in 2022 and the 2023 Outstanding Contribution to Victorian Sport Award. If you find our conversation informative, I encourage you to subscribe to our channel, hit the notification bell for updates, give us a thumbs up, and share this episode with other colleagues who could benefit from our insights. Thank you for tuning in, and let's dive into the discussion. PT Pro Talk is only possible with the support of the forward-looking and innovative companies like Sarah Health. Remote therapeutic monitoring sounds great, but also difficult. Sarah Health makes RTM simple and easy for your patients and providers. Check out sarahealth.com/PTProTalk for a special offer.
Welcome, PT Pro Talk listeners. Looking to enhance your rehabilitation practice or promote active aging? Urban Polling Inc. has you covered with our evidence-based activator polls and program, trusted by over 10,000 therapists worldwide. These unique polls, designed by an occupational therapist, improve stability, posture, and mobility for individuals with conditions like Parkinson's, stroke, arthritis, and ortho rehab. Visit urbanpolling.com/PTProTalk and enjoy an exclusive 30% off on CEU-approved courses and 20% off for activator polls.
Hi, Peter. Welcome to PT Pro Talk. How are you today?
I'm good. Yeah, it's nice and bright and early in the morning here in Melbourne, Australia. And looking forward to a chat.
Awesome. So let's get started talking a little bit about yourself and your background for the ones that don't know you yet.
Well, okay. I was born here in Melbourne, Australia, and I went to school and university here. Did a medical degree here, and then I worked overseas in England for a while, and then came back to Australia. And I started off in general practice, but my love was always sport. I'd always been a great sort of sports lover. I spent my whole childhood either playing sport or watching sport or reading about sport and so on. So it wasn't a great surprise to my friends when I sort of drifted towards sports medicine. And it was a time when sports medicine was really just starting here in Australia and probably in the rest of the world as well. It was sort of the early 1980s. And until then, there was never any sort of formal specialty called sports medicine. It was just, usually general practitioners or orthopedic surgeons who had a bit of an interest would, turn up to a football match and cover it. And that was about it. But around then, there started to be some sports medicine clinics opening up and some people doing full-time sports medicine, which hadn't happened before. So I got involved in sports medicine, got involved in a few things. So first of all, set up a clinic here in Melbourne called the Olympic Park Sports Medicine Centre on the site of the 1956 Olympic venue, hence the name Olympic Park. And that was a multidisciplinary clinic. It was and still is the largest sports medicine clinic in Australia. We have sports medicine doctors, physical therapists, massage therapists, dietitians, psychologists, exercise physiologists, and it was a great multidisciplinary approach to sports medicine. So that's been going now for 40 odd years. Then we started to sort of try and make sports medicine into a proper medical specialty, instead of just being a hobby. So we started an organisation called the Australian College of Sports Physicians, and we set out on a very long journey. We didn't realise it'd be as long as it was, on a very long journey to create a new medical specialty, which hadn't been done in Australia for 100 years. We had the Royal College of Surgeons and the Royal College of Physicians and so on, and here we were trying to start a college from scratch, and that really took about 15 years to set it all up, set up the examination process, the training process, and then go through all the political machinations of trying to get approvals for this specialty. So that took a big part of my life for a long time, and we finally got there after about 15 years, and
Wow.
it's now a fully fledged medical specialty, the same as. And, if you come out of medical school and you're resident training, you can choose to be a sport and exercise physician the same way you can choose to be a cardiologist or an orthopedic surgeon, and similar training, similar exam process, and specialisation in the end. So that was pretty exciting. So, certainly the younger generation now have got a pathway to go through, whereas we just sort of learnt on the job really, but now they have a formal pathway to go through, and it's become a very popular specialty, which is great. And in sports medicine, you work with sporting teams. So I guess I started working with sporting teams very early on in my career. I got a bit of a lucky break. I got chosen to go to Edmonton, Canada, with the Australian team for the World University Games, World Student Games. It was the first time they'd taken a doctor with that team, and because I had a connection with sport at the university, they asked me to go along, and that was really sort of career changing in a way, because I got to meet a whole lot of people there. I did 2 more of those in Japan in 2 years later, and then in what was then Yugoslavia, Zagreb, and what was then Yugoslavia a couple of years after that, and that sort of opened the door to a lot of involvement with sport. And over the years, I've worked with national sporting teams, swimming team, field hockey team, athletics for 10 years, our soccer team, and our cricket team. And travelled a lot with those teams. As a result of that, went to a couple of Olympic Games with the athletics team, the 1996 and 2000 Olympics. Then moved on to the Soccer World Cup in 2010 with the Australian team. Then after that, I spent 3 years in Liverpool, in England, working for the Liverpool Football Club. That was an interesting period, and they created a new position there called the Head of Sports Medicine and Sports Science, and they approached me to come over there, and I spent some time there. And then after that, I spent 5 years with our national cricket team, which is sort of the national sport here in Australia, and they travel an awful lot. We were on the road, a couple of 100 nights a year, really. It was a lot. But we do these amazing tours of England called the Ashes Tour, where you're away for 3 months and so on. So that was all pretty good. And in between times, I've done some professional football teams here in Australia. And so that's my team involvement. And the other sports medicine involvement was that I got approached quite early on in my career to write a textbook. And I thought, that it was way too early for me to write a textbook. But then my colleagues reminded me that I'd basically criticise every other sports medicine textbook around. So I thought, I better put my money where my mouth is, and hence clinical sports medicine was born. And we just really wrote that with my colleague Karim Khan, who's now in Canada. We really just wanted a how-to manual on how to practice sports medicine, and that was 30 years ago, and we're currently writing our 6th edition, and it's become the biggest selling sports medicine text in the world. So that takes up quite a lot of time writing that. It's you've got to write a new edition every 5 years, and it takes about a full-time year of my time to do that, to update it, and so on. So that's some of my sports medicine career, but it's been a fun journey along the way, and I've been very lucky in that I've been able to combine my passion, which is sport, and my career, which is medicine. And I think not many people manage to do that. So I always wanted a job that paid me to watch sport, and I managed to find one. So when I was a kid, I had dreams of being a sports person, but there was a slight problem there, and I didn't have any talent. So I had to come up with a plan B. So that's what it was.
What an amazing journey. Oh my goodness. And it's crazy to think there wasn't like a specialty that was recognized before. We just take it for granted, like it is something that's established. It's just crazy to hear that so recently established.
Yeah, and it was crazy. I remember going to their first meeting, and they said we're going to form a college, and I thought, oh, you can't do that. You can't just form a college. But we did, and then we got all enthusiastic, and some of the people who knew how these things work said it would take 15 years to become a specialty. And we said, no, you haven't seen us in action. We'll be there in no time at all. And sure enough, 15 years later, we got there. So it took a long time. But I'm really sort of proud of that achievement that we've managed to. Well, it wasn't just me; it was a whole group of us. But there's a lot of work goes into creating something from nothing, and we had a lot of roadblocks along the way, but we got there in the end. And it's just a really nice pathway now for young doctors who want to become sports physicians. It's actually quite now competitive to get into the professions because we can only train a certain number of people, and it's all done in the private sector. There's no government, not much government funding for this compared to the other specialties and so on. So, yeah, it had its challenges, but we've got there, and we've got fantastic young people coming into the profession now, and the quality of I probably wouldn't even get in now. It's the standard is so high. It's amazing. It's really good.
And I'm just curious to ask you, how was the process of writing the book?
Well, it was funny. I obviously had an idea of what I wanted to do, and I thought, very naively that I'd be able to write it in my spare time. And so after in the evenings and weekends and so on. So after 3 months and I'd written precisely 0 words, I thought, no, that's not going to work. So I sort of took the plunge and took a year off my consulting, and I just cut down to sort of one day a week, and took the rest of the time off, and so did Karam, and we set up he was living in a share house, and we took over his lounge room, and then we were on our sort of very, very early computers, and no mobile phones, or we were sending faxes around, and it was challenging, but we managed to put it out after a year, and then we had a funny experience in that we were very keen for the book to be not just for doctors, because we felt sports medicine is very multidisciplinary, and that we wanted physiotherapists and massage therapists and so on to be able to access the book and to be able to afford it. And so we were keen to keep the price low, and but the publisher said, "Oh no, the price is going to be." I think the original price was $129 Australian, which 30 years ago was a lot of money. And we said, "Oh look, we'd really like to keep it to under $100." And they said, "Well, it all depends on the print run, how many we print initially." And so we said to them, "Well, how many are you going to print?" And they said, 1,500, which was quite a large amount for a first book. And we said, "Well, how many would it take to print to bring the price down to $99? And they said, "Well, that'd be another 1,500, so it'd be 3,000. So we said, "Okay, well, we'll buy 1,500 books." And so we bought 1,500 books at our discounted price, and we sold them. We put together. There was no internet or advertising then. We printed out little brochures and placed them in journals and magazines, and with a little cutout bit to send back to us with a check. The kids these days never seen a check, but it's so we managed to sell all those 1,500 books, and then away we went. So it was a good experience. We've had a lot of help. It's not just the two of us writing it. We now have. Well, we're now in our sixth volume, sixth edition, and it's going to be 3 volumes. So our first, second, third, and fourth were just 1 book. The 5th edition was 2 books, and now the 6th edition is going to be 3 books. And we literally have a couple of hundred people helping us around the world. Fortunately, we've never been knocked back. No one's ever said no. because it's basically become the only sort of textbook around. And
Mm-hmm.
so there were a few others that have tried and not done that well. And it's such a massive task. I think people would look at it and think, oh my gosh, we could never do that. So we sort of got the market to ourselves a little bit, but that also comes with a responsibility too, and when we feel that responsibility to the profession to update it and to do a good job. And as I said, we have a couple of hundred people who help with contributions and so on, and they do a fantastic job. So, yeah, it's a real real combined effort by the sports medicine community to put that out. So it's very rewarding. You get to meet a lot of people, and we enjoy writing. We both enjoy writing, and just finding the time to write. That's the problem, because the rest of your life doesn't sort of stop completely. You have to keep doing everything else. But anyway, this will be the last one for me anyway. So I think my children say I said that last time, but I can't remember saying it last time. But yeah, this is definitely it. I'm too old for this caper. I'll hand it over to some youngsters.
How challenging without internet. So how would you put information together? You can't just Google it, all the papers.
Books and journal articles. I used to collect journal articles. I used to have hundreds of journal articles. I'd have them spread out all over the floor, and it was very different, very different. But my kids said, look at me as if I'm sort of from the ark, as if you what, you had no phone, no computer, Anyway, that was good fun. Yeah, it's a lot easier now.
Yeah, in our topic, let's shift gears now to talk a little bit about a new passion, I guess. I'll let you talk for yourself. That you have, so something completely different from, not completely, but not related directly, about relating diet, inflammation, and osteoarthritis. So let's first start talking about how did you start getting interested in that area, and how did you start the research?
Yeah, well, that's a good question, because if you'd asked me, sort of 12 years ago, if I'd be here talking about diet and the effect of diet on inflammation and diabetes and things, I'd have said, that'd be crazy. Of course not. But like many things, I had a personal experience, and that really changes your life. And so about 12 years ago, I was living in Liverpool, England, and while I was, I felt fine, and I was, if you'd asked me how I was, I would have said, I was fine. The reality was I wasn't quite as healthy as I could have been. I had a strong family history of type 2 diabetes. My father had developed type 2 diabetes at the same age I was then. I was quite overweight. I'd like many sort of, middle-aged men, I just put on probably half a kilogram a year or a pound a year for 30 years, just slowly getting thicker around the waist. And so I was quite overweight by then. And, I had a number of metabolic abnormalities. I had a high triglyceride level, high insulin level, and I had a thing called a fatty liver, which I didn't really understand, but I'd had that for a number of years. And so in now, knowing what I know now, I clearly was pre-diabetic, and probably would have been fully fledged diabetic not too much longer. And around that time, a colleague of mine in South Africa by the name of Tim Noakes, who's a very well-known sports scientist, he sort of came out and said that he thought we had it all wrong with diet, and that it wasn't fat that was the problem, because we've all been on a low-fat diet for 30 or 40 years. He said it wasn't fat that was the problem; it was carbohydrates, and especially processed carbohydrates. And at the time, I thought, oh, come on, Tim, don't be crazy. We can't have all had this all wrong for the last 40 years. And but anyway, I decided to look into it, and I started reading and got really interested. And the more I read, the more I sort of thought, well, maybe he's right. And the interesting thing is was not just reading about the sort of the pros and cons of carbohydrates and fats, but reading about the politics of how the low-fat movement had won out over the low-carb movement back in the the 60s and 70s, which I'd always assume was due to evidence and science and so on. But turns out, like most things in life, it's due to money and power and politics. And so the more I read, the more I thought, well, maybe this, he might be right, and I found it quite disturbing because, obviously we were all, following this sort of low-fat mantra for years. And mind you, we'd all just got fatter and sicker as a result. But, we thought it was right. And so I thought, well, I really should, try it out myself and see what happens. So I thought I'd do a little experiment on myself, 3 months of a low carb, sort of healthy fat diet. So on day one, I got my bloods done and weighed myself. And then I embarked on this diet. So I stopped eating anything with sugar, any sort of processed food, stopped eating all starchy foods, so no rice, pasta, potato, cereal, bread. I stopped eating any sort of soft drinks or fruit juices or anything like that. The only fruit I had was berries. So I went back to eating probably the way that my grandparents would have eaten, sort of meat and fish and eggs and all that cholesterol and butter, all that, fat and, cream and just avoided all those other foods. And so I almost immediately it had an effect on me, and then I stopped being hungry the whole time. So instead of sort of, having my breakfast at, in the morning and then 2 hours later feeling, hungry again, I would have, bacon and eggs and avocado for breakfast, and then I wouldn't feel hungry again all day. So I went from eating 3 meals and 3 snacks a day to eating 2 meals a day, and I eat 2 meals a day to this day. And then the weight started to come off, and I started to feel more energetic. I started to sleep better. I concentrated better. My exercise tolerance improved, and so on. So at the end of the 3 months, at the end of 13 weeks, I'd lost 13 kilograms in weight, and without even trying. I was never hungry. I ate really nice meals, all sort of, real food, no processed food. And the more fat I ate, the more fat I lost, which was just totally counterintuitive. I struggled with the whole concept. And then I did my blood tests at the end of the 3 months, and everything had gone back to normal. So my triglycerides are back to normal. My fatty liver that I had for 10 years disappeared. Everything was back to normal. And that really just blew me away. I just couldn't believe that you could have that effect. Eating really well, I sort of almost felt guilty, because I always thought, losing weight's supposed to be really hard, and yet I found it so easy and so enjoyable. And so I guess when something like that happens, Mariana, that you've got one of two choices. You can either say, "Oh, okay, I'm all right," and just go back into your hole and be happy, or you can become a bit of an advocate for that for what you've gone through. And to be honest, I didn't have much of a choice. People would come up to me and say, "Oh my God, what have you done? You look so different." And so I became an advocate for that way of eating, and started giving talks and writing. And we started a campaign in Australia called Sugar by Half to try and reduce the amount of added sugar that people took in. I was approached to write a book again, here in another book. I'd already written a few more books in the meantime, but and again, my initial response was, look, the last thing the world needs is another diet book, but they convinced me that there weren't many written by doctors and or by Australian doctors. So I wrote a book called A Fat Lot of Good, which turned out to be a bestseller and on the bestseller list for 3 months. And then the elephant in the room was always type 2 diabetes. I mean, it's a massive problem in Australia and in all Western countries. And yet, no one seemed to be concerned about it. There wasn't a lot sort of talked about. And also I was reading that there were some really good results in the UK and the US from a low carbohydrate ketogenic type diet in people with diabetes. And I thought, well, we need to promote this and explore this. And so I looked at trying to sort of license one of the programs from overseas, but eventually we decided to start our own program. So we created an app called Defeat Diabetes, and we produced a whole bunch of videos and articles and meal plans and recipes and cooking demonstrations and set up a program, which was initially an app and then became a web-based program as well. And it's been terrific. We've had over 10,000 people go through this program. You buy a yearly subscription, which is very cheap, and the results have been amazing. I mean, we've had more than half the people in our program have put their glucose into the non-diabetic range, and most of the others have improved their their sugar control and lost weight and got off their medications and so on. So it clearly works the same as it has in every other country. But for some reason, the medical profession doesn't want to embrace diet. They're more interested in drugs and surgery and so on. And this is a fabulous program, not just for diabetes, but for other chronic diseases that seem to be related to insulin resistance. So I guess that's a large part of my life now is promoting that diet and that program. And I've tried to sort of mix my new interest of diet and my former interest of sports medicine. And so I've been involved in some research looking at the effect of diet on conditions such as knee osteoarthritis. And there seems to be pretty good evidence that diet can have a big effect on inflammation. And we know that inflammation is a key factor in disease. So something like osteoarthritis, the itis means inflammation, so it's an inflammatory process. And things like diet, as well as exercise and sleep and so on, and reducing stress can impact inflammation. And so we're nearly finished a study looking at what we call an anti-inflammatory diet, which is basically it's a low carbohydrate, low processed food, real food type diet on knee osteoarthritis. And we've recruited 144 people who with significant knee osteoarthritis, many of them on the waiting list for a knee replacement, and divided them into two. One who follows a traditional sort of Western type diet, and the other that we put on an anti-inflammatory diet, where we basically discourage processed food and get them eating real food, similar to what I went through. And then we look at a whole range of different things. We look at body composition. We look at their function. We look at their pain. We look at various blood markers of inflammation. And so we've recruited all 144 subjects, and we're just finishing the collecting the data, and we'll have those results out in the next 6 months. But anecdotally, we're getting some really positive results. A lot of people are saying that they don't think they'll need a joint replacement anymore, and so on. So it's a fascinating area that is neglected in medicine, the role of diet, because I guess there's no money in diet compared to pharmaceuticals and surgery and so on. And so the medical profession, I think, has really done the world a disservice by ignoring the role of diet and how effective diet can be. And I just have so many people who come back to us and say, look, this diet's changed my life. I've lost weight. I'm no longer diabetic. I've got my bowel issues have improved. It's been shown now to have an effect on so many chronic diseases. Cardiovascular disease, asthma, mental health. Which is a massive issue. Anxiety, depression, and so on. I mean, someone came up to me recently and said, Dr. Brukner. I said, yes. And she said, oh, look, it was at the university. And she said, oh, I enjoyed your lecture the other day. And I said, oh, that's good. And, she said, oh, but that's not what I want to talk to you about. I thought, oh, gosh, what have I done? And she said, my husband and I are massive cricket fans. And because of you, we changed our diet. And my husband's suffered from bipolar disorder all his life. And he's now off all his medication, and you've changed our lives. I just wanted to say thank you. And I thought, wow, that sort of really opened my eye to the effect on mental health. And there's some really interesting work going on now in what they call nutritional psychiatry, looking at the effect of diet on things like bipolar disease, depression, schizophrenia, and so on. So it's a really fascinating area that I guess I love reading about and looking into. And I'm trying to sort of combine it a little bit with sports medicine. I'm really interested in the role of diet in concussion, for instance, which we're hoping to start doing some research into, and tendons, and lots of different areas. So, it's been a really interesting journey the last 12 years, and all came as a result of my own sort of personal experience.
That is crazy. I was listening to your talks, and I heard you talking about Alzheimer's and Parkinson, all these neurological diseases. Like, what? So like, what is the mechanism? Like, what is the explanation behind that?
Yeah, well, it looks like it's sort of related to insulin resistance, and that after a period of time, when you have carbohydrates, your body then secretes the hormone insulin, which drives the sort of the glucose out of the bloodstream, and stores it and makes it available for use. And after a while, you become resistant when you have a high carbohydrate intake. You become resistant to that insulin, and you require more and more insulin to have that effect. And with high insulin, you then get fat deposition in the pancreas and the liver, and obesity, and then slowly develop type 2 diabetes over a long period of time. So insulin resistance seems to be a major factor. And then, as I said, inflammation. I mean, sugar and processed food, the vegetable oils and so on in processed foods are very inflammatory in nature. And we now believe that like chronic low-grade inflammation is at the core of a lot of chronic disease. So from cardiovascular to mental health and so on. So we're tackling that sort of chronic inflammation with diet. And if you look at it, I mean, over the last century, really, we've changed. I mean, we've become much more obese and much more chronic disease. There are chronic diseases now that just didn't exist 100 years ago, and like, as you mentioned, Alzheimer's and things like that. And you've got to look at sort of what's changed, and people sort of say, oh, well, we don't exercise as much. Well, it's actually not true. We actually exercise about the same. Nowadays, it's more recreational exercise, and in those days it was more work-related. But the exercise hasn't changed much. What has changed is our diet, and in particular, processed foods. Our grandparents, they didn't have supermarkets with aisles and aisles of packaged and canned food and so on. I mean, they had fresh food, and so we've changed dramatically. Food has become processed. It's become cheaper. It's become tastier. It's brilliantly marketed. And it's very convenient, and it's easy, and people's lives are busy, so that's easy just to, buy a frozen pizza and feed the kids rather than, cooking up meat and 3 veg, So it's our diet has changed dramatically, and we really need to take a step back and get back to eating the way that our grandparents had eaten, because these chronic diseases are just totally out of control. I mean, there's more than 500 million people in the world now with type 2 diabetes. I mean, it was a rare disease, a couple of generations ago, and younger and younger. I mean, when I was at medical school, it was called mature onset diabetes, because people only got it late in life. And nowadays, young people are getting, type 2 diabetes. So I think, probably the single biggest thing we can do to improve our health is to improve our diet. And but unfortunately, where there's a lot of misinformation about diet, and we've been following this low-fat, thing for 30 or 40 years, which is all based on fraud. And when you take when they took the fat out of food 30 or 40 years ago, they realized it took all the flavor out. So they had to solve the problem. So they solved the problem by adding sugar. So the low-fat diet is a high sugar diet, and that's been disastrous, because sugar is very inflammatory and so on. So, it's a really interesting area, and one that I love reading about, and there's lots of interesting books out there now and so on. But I think it's something we've got to tackle, because we're getting fatter and sicker, and we need to do something about it. And drugs and surgery are not the answer. We've got to address the basic cause, which a significant part of which is diet.
Mm-hmm. And if you have to describe in like general lines, how is that diet when you say low carb? Keto?
So it's really real food. So it focuses on things like meat and fish, non-starchy vegetables. So no sort of potatoes and so on, but above ground vegetables, green veg and so on. Dairy, so butter rather than margarine. Margarine's a terrible chemical concoction. It's not food at all. It's highly processed and so on. So dairy, reducing high sugar fruits. So the only fruit I eat is berries, nuts, water, tea, coffee. Avoiding soft drinks and fruit juices. When we were growing up, we were told fruit juices were healthy. And they're actually got as much sugar in them as Coca-Cola. So just avoiding sugar and processed foods. And there's a great saying that just stick to the outside of the supermarket, because all the good food's on the outside and all the processed foods in the middle. So just meat, fish, eggs. Eggs were demonized for so long because of supposed high cholesterol, and yet we've known for years that the cholesterol in food has no influence on your blood cholesterol, and yet poor old eggs got demonized, and they're incredibly nutritious and have so many good things in them and so on. So yeah, meat, fish, eggs, dairy, non-starchy veg, berries, nuts, tea, coffee. I eat really well. People say, oh, it's really hard, it's not sustainable. Well, the only people who say it's not sustainable are people who haven't tried it, because you feel so good when you're on this diet that it's very easy to sustain. And even when you're out, I still go out, quite a lot, probably cook more at home than I used to. But even when you're out, you can always find, things that are low in carbs. People say, oh, you can't go to Italian restaurants because you can't have pizza and pasta. But, there's always a meat dish there that's always fine. So, I don't find it difficult at all to sort of follow this this way of eating. I don't even like to call it a diet, because it's really just a diet. To me is temporary, but this is just the way we choose to eat, and it's very enjoyable. And I eat really well, and my weight stays stable, and I haven't put it all back on. And so many people, when they diet, they go on this really strict low calorie diet, which is painful, because you're hungry the whole time. Well, you're hungry, hungry and angry, and it's not sustainable because of that hunger. Whereas when you're eating a low carb, sort of higher fat, higher protein diet, you don't have that hunger, because it's carbohydrates that make you hungry. It's fats and proteins that make you feel full. So that's why it's sustainable, because you don't have that hunger the whole time of normal diets, and people who have these yo-yo diets and so on, and it's not sustainable.
Yeah, and no pasta, no rice, no potatoes.
Well, I have cauliflower rice, so I just use cauliflower for rice dishes, which is lovely. Really really nice. I use zucchini pasta, so I still have my rice and pasta. It's just it's just different, and so yeah, and I don't have a lot of potato. I have a little bit of sweet potato, but no potato. But it's you don't miss it. There's so many nice, great recipes and great ways of cooking and so on. So I don't find it hard at all.
And what other musculoskeletal issues that you've been seeing a relation? Like you mentioned the knee osteoarthritis. Is there any other conditions that you've been noticing?
Yeah, well, I think all the inflammatory conditions. I think tendon issues. That's what we'd like to research next. There's a little bit of evidence about the effect on tendons. And interesting, in my own, I'd always had Achilles tendon problems, and always used to get out of bed in the morning and feel a bit sort of stiff and sore in my Achilles. And after about 6 weeks of this diet, I remember getting out of bed thinking, oh, that's weird. I sort of started patting my Achilles, and it wasn't tender the way it usually is, and so on. So it sort of makes sense. If you're reducing inflammation, you're reducing all these things. So arthritis, tendons, as I said, there's some really interesting stuff going on with concussion, about the use of a ketogenic diet and concussion, and I'd love to look into that more from a diet point of view. So really, from a sports medicine point of view, there are lots of areas where, and the other interesting area is people say, well, you need carbohydrates to fuel the body, and maybe at an elite level you do, but for the average person who's running a marathon or doing an Ironman or something like that, they can fuel themselves without carbohydrates, because we have an alternative fuel, and that's fat and ketone bodies. And if you don't take in carbohydrates, your body can switch fuels to ketone bodies. Hence the word ketogenic keto diet. and you can fuel yourself with fat. And we've all got plenty of fat to fuel yourself. So, I've had people do marathons and even Ironman triathlons on no food, no breakfast and just some fluids during the race, and they've been fine because their body is adapted to using fat as a fuel rather than carbohydrate. Now, if you're an Olympic, 10,000 meter runner, maybe it's a little bit different. But for the average person, running a 3-hour marathon or whatever, you're absolutely fine on that, and you don't have to have these vast amounts of sugary drinks and gels and pasta the night before and so on. So it's a fascinating area, because it really concerns me that we've had a whole generation of athletes who've had massive amounts of carbohydrates, often in the form of sugar, in sports drinks and gels and so on. And I'm concerned about the long-term effect of years of intake of those things. You're going to become insulin resistant, and you're more likely to have some of those chronic health issues. So, it's actually good to be able to reduce the amount of carbohydrates, even for an athlete, I think.
Mm-hmm. And when you do this diet, is the goal to stay in ketosis? Is that...
Well, no, not necessarily. I mean, I don't stay in ketosis. It really depends. There's a spectrum, and it really depends on what your goals are and what your problems are. I mean, if you're, morbidly obese, or you've got type 2 diabetes, or you've got these chronic issues, you need to be at the sort of the ketogenic end of the carbohydrate intake, if you like, under 50 grams a day, But if you're, young and fit and healthy and insulin sensitive, you can have, 100, 120 grams of carbs a day, and you won't be in ketosis, but it's just low carb. The average, Westerner probably has 250 grams of carbs a day, which is way too much. So cutting down to 100 is going to have a big impact on your health without necessarily having to go into ketosis. So, I guess in retrospect, I was probably in ketosis for the 3 months of my really strict, diet and weight loss. And then I just eased off a little bit, and I probably have, I don't measure my carbs, but I probably have 70 or 80 grams of carbs a day. And that's fine. It keeps my weight steady and keeps my blood tests fine and so on. But everyone's different. Everyone has the right amount of carbs. It's a matter of finding out what's the right amount for you. But certainly no one needs 250 grams of carbs a day.
Mm-hmm. Mm-hmm.
The hardest thing is just getting your head around the fact that, we've been told for 40 years that fat is bad, and that's, it's quite challenging to sort of suddenly start eating all these things that, we've been told are bad. But you get over it.
Yeah, and I think what's crazy that you mentioned about the fat, you're consuming fat, so you think you're going to be more prone to have high cholesterol in your blood and your, in your exam, so people stop having fat.
Yeah, exactly. And that's just wrong. And, saturated fat, animal fat has been demonized for years. And yet, generations of people have been eating animal fat without any problems at all. And I think it's very unfortunate that people have gone off fat and now eating all these sort of processed fats, these omega-6s, the processed vegetable oils and so on, which are not nearly as healthy as good old-fashioned, butter and steak and things like that. So, yeah, we need to go back to, we've just got it all wrong. And as usual, it's usually money-driven and, people want to make a lot of money out of processed food and so on. But, no, I think let's just back the farmers and their real food.
And you said there is no evidence about that, right? About the fat.
Yeah, that's right. That's all sort of no. There's lots of reviews of the effect of saturated fat on cardiovascular disease and so on, and none of them show any effect. But it's just people getting their head around the fact that that's what we've been told for so long. So back to science. You got to look at the science, and the science doesn't support. There's no, we've all been on this low fat diet with no evidence to support it. And yet we all just follow the mantra and. It's been a disaster. We've just got fatter and sicker for 40 years, and it's a massive problem in our society, all this chronic disease.
Yeah. And bringing to us as physical therapists, when you see patients, so what would you advise us to do? Would you just suggest the patient to, go see a doctor, a nutritionist, or just talk about research? So what would you suggest for what physical therapists can do to
Yeah,
help?
I think it's a really important role because physiotherapists, have a lot of influence because you tend to spend a lot of time with patients, much longer than doctors do. A doctor will see someone for 5 minutes, and that's about it. And you tend to develop very good relationships with patients and talk to them. And I've now got a lot of physiotherapists here who are just counselling, chatting to their patients about the role of diet and encouraging them to improve their diet and reduce their inflammation. And it'll make a big difference to their problems, and makes you look good, and the physiotherapist looks good because they're getting good results. And and just reducing the amount of sugar and processed foods, I think, is a starter. Just even to get them to cut out sugar, or to reduce the amount of sugar. And you'll find that their musculoskeletal problems, whether it's tendons or joints or whatever, will improve because of the reduction in inflammation. We hand out all these anti-inflammatory drugs, and yet we have this power to reduce inflammation with diet. So I think as a first step, you don't have to go into great detail about nutrition. I wouldn't refer them to dietitians or doctors because they don't know anything about diet. I just become a bit of an advocate yourself, and just simple things. Just have a quick chat to them about their diet and how much sugar they have, and that's a good first step. Just cutting or reducing the amount of sugar. The average Westerner probably has about 20 teaspoons of added sugar a day, mainly in drinks, and yet the World Health Organization says anything more than 6 is not ideal. So just cutting that back is a good first step.
Yeah. And how about the lifestyle factors that have influence on inflammation?
Yeah, well, I think apart from diet, there's exercise. So, we know that sedentary people have more problems with inflammation. So we encourage, exercise, certainly. And, we all agree on that. I think, stress is an important factor. I mean, we need to, address that. I think, one of the reasons sometimes people don't, get better when they should get better from various conditions is underlying stress. So I think that's really important to address. Obviously, things like smoking and alcohol intake are important. And the other thing I think is really important is sunshine. I think it's really important both for vitamin D and for things like nitric oxide and so on. We've become very sun averse over the last generation or two because we've been told keep out of the sun, you'll get skin cancer and so on. But I think we've gone too far the other way, and we now avoid the sun, and the sun has a lot of benefits. So I really encourage my patients to spend 20 minutes every day in the sun if they can, not in the middle of the hot midday sun, but just at either end of the day, get out and get some sunshine and so on. So all those factors I think are important, but I think the most important factor is diet.
Yeah. And so you have to come back when your research is done to tell us the results.
Be very happy to. Yeah, very happy to. No, it's exciting. We can't wait for the results. It'll be good.
If people want to research more about the topic, is there any, what do you suggest them to look? Is there any papers and things that they can read?
Yeah, sure. Yeah, well, there's they can go to defeatdiabetes.com.au, which is our website, and that's got an area specifically for healthcare professionals with a lot of information in it. If you want to watch videos, go to Low Carb Down Under. Low Carb Down Under. It's got a whole bunch of great videos from people from all over the world, and that on lots of different topics related to diet and low carb and keto and chronic disease. So I think if you do those things, then that'll lead you to all sorts of interesting areas. So it's a fascinating area.
Awesome. Peter, anything else before we wrap up? Any message that you want to give to the audience? Anything?
No, look, I think I've said enough about the benefits of diet. But as I said, I would never have imagined I'd be speaking like this. And but I just want other people to, and it just, you can do. We all go into the the medical and health professions to try and help people. And honestly, this is the way in which I've had the biggest impact on people in my career, and I just want other people to learn about that.
Yeah, and it's interesting because as we were talking about it, I was thinking about someone in my family that has Crohn's disease and has had for like since, she was born. And she started a diet this year and she went in remission. And like she's been taking these like genetic injections, I don't know how you call it. This medication, like strong medication. And since she started the diet early this year, she repeated her exams, and I was just thinking maybe it's, it's related to that diet. I will start connecting the dots. So I think that just talking about it, like you bring it to my attention, I stopped to think about and, start maybe seeing, maybe there is a relation there and we can potentially help many of our patients just knowing this information and sharing with them.
Yeah, no, absolutely. I'm not surprised. I've had a number of people with Crohn's disease, ulcerative colitis, lots of bowel issues. Yeah, and it makes sense, I'm glad to hear. That's very exciting.
Yes, awesome. And then if people want to find you or contact you, is there a way they can do so?
Yeah, sure. Yeah, through Defeat Diabetes, they can contact me or peterbruckner.com.au. So yeah, that's fine.
Peter, thank you so much for taking the time and share all this knowledge with us. Something new that we can, start implementing in our practice and paying attention to, our patients and all these other problems, health problems, neurological problems, and all these other many things that you're talking about. So it's very exciting.
No, thanks for having me. It's been really enjoyable.